Okay, this is one for Jane. She asked me a question actually on a persistent cough following radiation and chemotherapy. Before we start, it's important to bear in mind that any persistent cough of any type should be checked out. If you've got a productive cough or a dry cough or a hacking cough or something that's not going to go away, it may be something that's benign and not a problem, but it may be something more serious. So please get it checked out by your local doctor, or if you're under the care of a specialist, get it checked out by them. Specifically, Jane's question was about chemotherapy and radiation giving her a cough. Chemotherapy and radiation works by killing cells, radiation particularly by killing cells at the nuclear level, and it causes inflammation, and inflammation leads to scarring. The lungs are very sensitive to that, and what can happen is that you get scarring around the little sacs that are called alveoli in the lungs. They're like little balloons, little grapes in the lung, and they're what transfer oxygen backwards and forwards between the lungs and your body. So those getting scarred will cause a problem with breathing, with tightness of the chest, and can often lead to a cough. So your specialist, Jane, is quite right. There's very little that can be done for it. If you look at the research, sometimes vitamin E in high dose can help, but it's mainly about putting yourself in a position where you maintain your health. So eat well, drink well, please don't smoke, please don't be around anybody else that smokes. And if you are a vape user, and that will be another blog and another day about vapes versus cigarettes. Vapes are not really very good for you. They cause what's called a restrictive lung pattern, so it's very hard to breathe. Your chest is tight and it doesn't, it can't really stretch. So vapes aren't that good. So Jane, in answer to your question, it looks like it's pulmonary fibrosis in relation to the radiation and chemotherapy that you had. It unfortunately will be with you now forever, and it's a matter of keeping yourself fit, well and healthy. But if the cough persists, like you did, mention it to your specialist, mention it to your GP, keep going there and keep getting checkups. That's really important. And for anybody else that's got a cough, the same thing. Please go and get that checked out. A bit of a longer blog than normal, but that's an answer to a question from Jane. Thanks for the question, Jane. Anybody else got any questions, please keep them coming. Bye-bye now.